right, I think we have everybody pouring over from the Dr. Jason Lazar presentation that went over just a little bit. Welcome to the Salesforce, Transcendent, and Frost & Sullivan panel today. Digital triage, sharing the right data to make the right decisions, being moderated today by the one and only Paul Sonnier. So, Paul, I'm going to hand the virtual mic over to you to introduce Michael and Rachel, and looking forward to the conversation.
Well, thank you, Jerry. Really great to be here. Another HITLAB symposium. Always a pleasure. So, I am both a HITLAB senior fellow and also work at Frost & Sullivan, where I'm industry principal for healthcare and life sciences. And Frost & Sullivan, for those who aren't aware, we support our clients in three core ways in their growth journey. So we do syndicated market intelligence, and we combine that with analyst touch points, allowing companies to understand the future of markets and emerging opportunities across the broader health and life sciences. And secondly, we do qualitative and quantitative custom primary research to support voice of the customer that drives product marketing, and geographic opportunity decisions, as well as corporate strategy decisions. And then third, we do brand and demand marketing solutions that support thought leadership and content marketing, as well as lead generation. So that's a little bit about Frost & Sullivan and my role there. Today's panel is titled Digital Triage, Sharing the Right Data to Make the Right Decisions. And I'm really honored to be joined by Dr. Rachel George and Dr. Michael Verdon. So Rachel is from Salesforce. She's the global lead health system advisory and innovation. And Michael is the co-founder and chief medical officer at Transcendent Care. And so with that, why don't we have Rachel and Michael give brief self-introductions, and let's start with you, Rachel, please.
Thank you so much, Paul. It's great to be here. Thank you for inviting me to be part of this panel. So a little bit about me. I am an internal medicine physician by background and have been leading healthcare organizations both nationally and locally here in Chicago for the last 15 or 20 years. And I was in the provider services space, really focusing on improving quality and throughput and population health and all of those great things that need to happen in healthcare. And a while ago, I looked around and I said, where can I really make an impact in healthcare? Where's the tip of the spear now? And I thought, technology is really where that tip of that spear is in healthcare. Paul, you and I were talking earlier about the fact that, 10 years ago, because of all the challenges with, some of it was regulatory, some of it was that technology hadn't moved fast enough. Technology in healthcare wasn't very interesting, but in the last 5 years, so much has happened and evolved and changed that it really has become incredibly interesting. And in Salesforce, and we'll talk about this a little bit more as we go through this presentation, we really believe that that the platform is fundamentally important to making technology in healthcare successful. And so, having a platform that you can connect all of the multitude of different applications into it. And so that's what we do, and that's who I am. And so I'll turn it over to Michael.
Yeah, fantastic. Thank you, Rachel.
Yeah, thank you very much. And thank you for having me on this panel. It's totally very exciting for me. My name is Mike Verdon. I'm a board certified neurosurgeon. I was also a physical therapist in a former life. I've been caring for spinal patients for about 20 years, 25 years now. And I'm in private practice. I'm solo practitioner and do spine surgery only for the past 8 years. I'm also the co-founder of Transcendent Care, who I'm representing today. And what we did was we started to use that technology that Dr. George talked about and said, how can we make decision-making and patient flows better? And we came up with a couple of different products that we use that are linked together that we feel like gets the patient through the healthcare system, gets the right treatment to the right doc at the right time, with eliminating low-value care from the practice, essentially, and just making the experience better for both the doc, me, and my patients. And I agree. we are going to have to use technology to push the care forward, to evolve it essentially.
Yeah, well, fantastic, Michael. And we have a little bit of history. So Michael and I connected on LinkedIn. So for those that aren't aware, I have a pretty large group on LinkedIn called Digital Health, has over 100,000 members. And Michael, I think, joined the group, and I saw what he does. I saw his company. I said, I'm having some back pain. Maybe I'll reach out to him. And sure enough, we had a conversation, and he actually, via his solution, helped diagnose me. We think it's a diagnosis that's probably going to help prevent some unnecessary treatment that I had lined up, and result in better outcomes. So definitely platforms enabling that, and right. Solutions like Transcendent Care. So Salesforce and Transcendent Care are really critical in this journey, and it's really personal to me and obviously everyone. So with that, I know we had some questions lined up. Maybe Michael, you could go into a little bit more detail about what you do at Transcendent Care. You mentioned 2 different solutions, and how that, and we'll go to Rachel, of course, but how that fits onto the platform like Salesforce.
So under the concept of a digital marketplace or a digital front door for healthcare, when patients come into a system, they're taken in and we're going to triage them. And we do it based on their symptoms. And it's a simple question-driven platform or a document that they fill out. And the severity of those symptoms will determine where they go inside a practice or who they go to. Not everybody needs to come to see the surgeon right away, or not everybody needs to be delayed from the surgeon. So we have it's a 3-minute questionnaire. It's based on statistically relevant and verified studies where we can take a patient and put them to the right patient to the right treatment at the right time. So that gets them in quick. For us as a practice, we acquire patients quickly. We make contact digitally. So essentially, you can get our opinion if you have a if you have a connection to internet. And then from there, you get pulled into the system, and we go into further diagnostics. And that's just basically symptom-weighted algorithm, which determine which actual pain generator is causing the symptoms to help eliminate the guess mechanism, or it really gives us a focused way to treat the next patient, meaning the next symptom, or to eliminate symptoms, again, to eliminate care, wasted care. So for us, to have a larger platform to hang off to coordinate all these things, to coordinate multiple products to provide for us or to push through to another system, we have to have a partner. There's no way to do it. I'm spending my time on developing tools to help utilize those tools, or to get that information to the next person. I don't have the capacity to do that. And that's why a company like Salesforce, with their significant infrastructure, can make the job easier for us and better for patients.
Yeah, and maybe Rachel, you could kind of add on to that with what Salesforce is doing in healthcare, how you're enabling companies like Transcendent Care, and also helping healthcare organizations directly.
Yeah, no, absolutely. So when you think about care of the patient, right, we think about what happens when the patient sees the doctor either in their office or when they see them in their in the hospital. And all of that documentation happens in the electronic health record. And we don't want to do anything with the electronic health record. But let's be real, the electronic health record is really about improving billing. I mean, that's really what it is. Yeah. It's fundamentally a billing tool. It doesn't do a lot to coordinate care. And we know that 80% of the patient's health actually happens, by impacting the determinants of health that happen between those visits, right? Do they have, we can talk about social determinants of health. Do they have the health literacy to be able to understand their care? Are they getting good nutrition? Are they doing their physical therapy in the case of back pain? So a lot of what happens, a lot of what's necessary for health actually happens between those doctor visits. And so we don't have a system that really integrates all of that different type of care that needs to happen. And that's where, kind of a platform really is very important and fundamental to coordinate all of that care. And then, you know, you have so many amazing, you know, kind of apps and organizations out there, a lot of which I heard about today. I mean, just great sessions that we had today. But whether it's somebody that's going to, you know, an organization for their mental health issues, or it's because they're going somewhere else to lose weight, or they're going somewhere else for their back pain, like how do we like coordinate all of these different places that people are going to for health now, or they might be going to their physical therapist, into one place. And so if you have that platform, you're able to draw all of that information into one place, so that there really is one source of truth and
Right.
one place where the clinical team can go to really work and improve that patient's overall health.
Yeah, and you know, it's interesting when you mention, you know, fragmentation in healthcare, both, you know, and how we receive it, and also the data. And so it's interesting when we think about that fragmented data, you know, and how we can apply tools like machine learning and algorithms. And I think this is a question really for both of you. How can we overcome that with those tools in particular, or, you know, in general, just the platform of Salesforce? So, you know, take that, either one of you want to respond first.
I'll be happy to start. No,
I can pick someone if it's easier.
Happy to start. So, you know, one thing is that if you have, you know, a system or a platform, you have one place where everything can be connected, and you know, you have the ability to build onto that platform also, and to be able to create that. You know, in healthcare, we've never had insufficient data. Like, we have data coming out of our ears. I mean, let's be real, but it's the ability to have usable data. When you have millions and millions and millions of data points, which we do on most patients, a lot of our complex patients, it becomes unusable. And so that's where machine learning is so important, and artificial intelligence has become so important. Is how do you take all of that data, the 1,000 Dexcom readings that your diabetic patient has, and convert them into something usable and as actionable.
Yeah.
You know, I agree. We felt like that the data was inaccessible. It's all in free text, and it's really difficult to access to bring up like a diagnosis or assessment and treatment planning. We focused on data set creation around disease states. What would classic data presentation, or what would classic symptom presentation be for a certain spinal diagnosis, sacroiliac pain or radiculopathy? And we made models like that and collected that model to reinforce it, to basically look at a diagnosis. To me, the platform is massively important, because you have to collect clean data or get structured data, put it in a place where it's unified. And that's what a platform would do for you. When you unify it, you can accelerate it, you can clean it, you can advance it, you can take it from a data point to machine learning to essentially AI. But there's a bridge that has to happen. It's not going to happen now, it's not going to happen tomorrow, but you have to have the infrastructure. So basically, platform inside of healthcare is the infrastructure to allow that to happen. If you don't have that, you have continued fragmented care. And things like care continuum are just a theory. They're not real. And we'll never really get our hands around population health, which is sad because we have too much technology. So it's just a matter of bringing the data together in a place where the docs can understand it, clinicians can use it, patients can benefit from it. Certainly we have the technology, but we have to organize the data in a way that it's functional for everybody.
Yeah, and so when you're trying, oh, sorry, Rachel, go ahead.
No, I just want to talk about one point that Michael said. I mean, is the data usable? And the fact that we still use faxes in health,
Right.
I just laugh every time I think about it, but it's not
Right.
you know, how do we take all of that material that we have on paper that's there historically? First of all, never put it on paper again, but you know, how can we use AI and, you know, to convert that into digital data that now becomes actually useful?
So someone in the chat bot just asked about unstructured data, and we tried to get at to that. Can you use it? And the problem is, like Dr. George had said, unfortunately, EHR has turned into a big ATM. So it's not really about clinical documentation or functional disease states or severity of symptoms. It's about, how do I get this to bill? To use unstructured data, you have to go back and mine it through natural language processing. I've done a small biopsy. It's really going to be difficult. So it's like trying to make clean water from dirty water. It's going to be very, very, very difficult. And I think that functionally we could do it, but I think there's an easier, softer way, and that's just do the work, create clean data sets and push them through a larger mechanism where more patients interact with a new way. So this is digital healthcare, or EHR 2.0, which it's an evolution. We're evolving, and we should. Otherwise, medicine goes nowhere. So yeah, we could look at the past. I think we look at our past experiences for data sets, but the data itself, it's almost like when they struck oil, they didn't really know what to do with it, so they burned it a lot until they could cap. It's the same thing, because data is oil. It is a commodity, and we got to figure out a way to use it.
So interesting, an interesting analogy. Hopefully people aren't burning healthcare data, but yeah, but it's going to waste, I guess is the point, right?
That's my point. Yeah. That's my point.
So kind of on that same theme, this data is out there, and oftentimes it's behind walled gardens. Somebody else owns it. You can't access it. Patients can't, port it, easily themselves if they're in different health systems. So, I mean, what challenges have both of you encountered in that? And I'll pick Rachel first this time, so there's no confusion. We can come back to Michael.
Sorry, Paul, you were saying, what are the challenges that we've encountered?
Yeah, as far as like ownership, when say that this data could be of use. Yeah.
Yeah, no, I mean, it goes back into, kind of HIPAA and, and who owns the data. I mean, in my opinion, the patient should always own the data, right? Like it should always be theirs, and it should follow them wherever they go. You almost want to create a ledger type of system. A lot of what you're talking about with blockchain, in term where it's kind of unmovable information that goes with the patient wherever they go. I mean, I think till now it's been health systems, hospitals, physicians that claim that they own the data, but it really needs to be able to move with the patient wherever they go.
Yeah.
For us, the patient owns the data. It's theirs. It's their symptoms. I can't claim to have those symptoms, but they, like everything else in my career, patients have taught me. So they're letting us use that information temporarily to inform our models to what the diagnosis could be. And I think the beautiful thing about that is the next patient who comes down the road gets the benefit of the machine learning from that experience. So you kind of shorten the time to expertise, but always the patient should own that. And I 100% agree with the blockchain chart. I think that's exactly the way we're going to have to go. And it'll actually liberate the patient from the system, but also create opportunity for true data sharing. For true sharing, because someone shares their data they choose to, and they own it. So,
yeah, interesting. And when we think about platforms like Salesforce, there was some news recently. Think about Oracle and Cerner wanting to create a national EHR data cloud or record. Is that something Salesforce is looking to do as well, or what are your thoughts on that, Rachel?
Yeah, we believe absolutely in sharing of data and making sure that it becomes accessible at the point of use when it needs to be. So we strongly believe that, we should be, all of our systems should be connected. And so we create, systems that are meant to be connected to others. And we think that's important. We think it's important for the patient, most importantly, and, kind of overall health of the population as well.
Yeah, that's interesting. So I guess the point being, as long as the data is interoperable, everyone can share in that, and the patients benefit. And the question of ownership, of course, is, I guess we're still resolving that one. As far as patients owning their own data. I know Apple's done some good work in that regard, but the data is just so fragmented. It's everywhere. It's kind of even hard for a patient to access it, as we know, even though the laws say it should be accessible. There can be challenges to that. And I think in that regard, I think Jorge asked another question in the chat about automizing this process, automating, sorry.
Well, I think, so some of it's going to require supervision. So triage means put the patient where they need to be. It doesn't mean 100% of anything. It's just you're trying to move the patient along. It's like skipping the line in the bank. If you're a big wig, you get put into the manager's office. If you have a big problem, you need to see the doc now. And so that's all triage means. And we're just going to move you to the appropriate phase or level of care. And by the way, this happens in every ER across the nation every night when they have a triage nurse sitting out front. So it's kind of automated now, but 100% no, there'll be some supervision. And I think that will help everybody like lower the expectations and the anxiety level about the machines taking over. Because there's a lot of people afraid of that, like, oh, this machine, but no, it's going to be supervised. But there could be a point where the machine that we have right now is about 75 to 80% accurate. So 80% of the time, it's really pretty much right on the money. Does someone still touch it? Do we still see it? Yes, we're still looking at it and making sure it's accurate to improve it.
Yeah, I mean, I think it's really important that we do get triage right, and we do need AI to be able to do it. I mean, unfortunately, to this day, there are still cases that happen where a patient was not triaged appropriately and ends up dying in the emergency department waiting room, right? Like that should never happen. That should be a never event, just like, surgical wrong site surgeries are a never event.
Right.
A patient getting to the hospital and then dying in the waiting room, that should become a never event. And we can only make that a never event when we get really, really good at these AI tools that can triage them appropriately.
I think what would happen is the granularity on that missed event would then trigger what's the pattern, like we were talking about before. So there's patterns to everything. And sometimes we miss patterns. So what's beautiful about the data being collected in a way to look at it, we can then explore pattern identification for what's being missed. We had a conference yesterday where there was a question about this person was triaged inappropriately, and we went back and looked at the data patterns. So, oh, look, there's an insight here we never saw. So that's when the machines inform us, which is really what progressing medicine should be. We shouldn't be doing the same thing over and over again with a new generation of physicians. That's a crime. I mean, but that's what happens when I leave practice. All that experience is essentially gone. But if we can capture it in data patterns and then inform the next group of physicians coming on, the care from me, thank God, will be better. And that's really what we need to do to evolve and to move forward. And it has to happen from a platform basis, wide data collection, multiple tools, and there has to be sharing. Otherwise, this will be siloed and it really will just be a bunch of talk.
Yeah, fantastic. Kind of makes me think of, we've got the resource constraints as well. And as we develop and evolve these tools and they become more robust, more utilized, and they scale across healthcare, it can help address our resource constraints as well. So, it's really great what both Salesforce and Transcendent Care are doing. Thank you both, Rachel, Michael. Real pleasure speaking with you, and hopefully we can do it again soon. Any last thoughts? Let you, Rachel and Mike. Rachel, you can go first.
Yeah, no, so thank you for the opportunity. This was a great discussion. I love what Michael is doing at Transcendent. And I think this is really the future of health, is how do we make everything digital? How do we use AI, and how do we put it all on a connected platform so that it is absolutely interactive and the patient owns it and everybody can see what's going on.
Yeah, I echo that. I mean, I'm very grateful to have the opportunity to talk to you guys and share with you all what we're doing. So happy that Salesforce has thrown their hat in the ring and want to make a difference in healthcare. I think there's a huge opportunity for little guys like me and the big guys like Salesforce to go out and really transform and shape care. And that's why I'm involved. I want to, as a doc in the trenches, want to shape care. And obviously, Salesforce is in that same game too. And I think we, if we work together, we definitely can make a big difference.
Yeah, fantastic. Thank you again, Michael, Rachel. Real pleasure. And
thank you.
With that, say goodbye. I think hopefully Jerry's still online. I think we're on time. Maybe a little over, and we can keep talking.
Yeah,
He might be on mute. I don't want to go too far and into the next
Oh,
panel.
there he is.
How are we doing, Jerry?
Yeah, I think we're good, Paul. I apologize. I had to just start off the next panel
No
with
problem.
Stan. But I'm sorry I didn't really get to hear the discussion as I was trying to get Stan to put his camera on.
They're trying to get you to put your camera on too.
I trust it was really good. I just saw a couple of great discussion comments come up from the chat. And yeah, we saw a pretty strong turnout here at the very depth of the summit. So yeah, I mean, look, it's always great to have you on, Paul, and to moderate a panel. And Dr. Dr. George, Dr. Verdon, thank you, for coming on, sharing your insights, and hope to have you guys back on again sometime in the future.
Thank you.
Yeah, thank you.
It's nice to meet you, Rachel.
Okay, fantastic.
Thank you.
Hi, everyone.
Okay, everyone.
Paul, see you. Thank you very much, sir.
Everyone.
Thank you.
See you later,
Yeah.
guys.
My pleasure.